Mateo County did not join several Bay Area counties in preemptively implementing the governor's stay-at-home order. And joining us now to talk about why, the chair of psychiatry and medical director for the county's behavioral health and recovery services, Dr. Vanessa de la Cruz, and San Mateo County's deputy health officer, Dr. Curtis Chan. Doctors de la Cruz and Chan, thank you so much. Appreciate you being here.
Thanks for having us.
All right, I want to start here. The county's public health officer, Dr. Scott Murrow, issued a very detailed, very thoughtful, and very controversial analysis explaining why San Mateo has not joined the Bay Area stay-at-home order. And one thing he said, I'm going to put this up, quote, "I'm not sure we know what we're doing. I look at surrounding counties who have been much more restrictive than I have been and wonder what it's bought them." Dr. Chan, can you explain what your boss means by those sentences, because we don't want to misinterpret?
Yeah, so Dr. Morrow and I are very concerned, and we believe that we need to set out a very loud alarm. There is a surge of cases occurring, a surge of ICU beds, and we definitely need to respond immediately. And what we're hearing from community leaders is that they need to better understand how transmission is occurring, particularly asymptomatic transmission. And we've also reviewed our data, and we've talked to our contact tracers, our disease investigators, and what we found is that most of the transmission is occurring from social gatherings. They're happening also within households. And it's happening particularly from asymptomatic and pre-symptomatic individuals. So that's why we want to focus our messages and our interventions to prevent transmission through those types of gatherings.
All right. So it sounds like the priority has not necessarily maybe been on the right place with regard to the state orders. Dr. Chan, Dr. Morrow's statement also says what we have before us is a symbolic gesture. It appears to be style over substance without any hint of enforcement, and I simply don't believe it will do much good. Look, is that a criticism of the state's approach to deciding what stays open and what closes, or is it a criticism of not enough enforcement, perhaps?
I don't think it's an enforcement. I don't think anybody knows the absolute right answer to change social behavior. We're realizing this is due to people socially gathering with other households. And really the question is, will another layer of restrictions and orders change those types of behaviors if they haven't changed so already? So what we're hearing from our community members is that they want more education, more graphics to explain things. And that's what we've been working on for the last 2 weeks, to be really focused and partnering with our community-based organizations, our businesses, and we definitely want to hear from our community. But it's really immediate, and we really need to do something now. We have 3 simple messages that we want to explain to people. Number 1, and it spells the acronym AIM. 1, always mask in public, particularly when you're talking. We see so often people pulling down the mask when they're talking to their neighbor. Number 2, insulate your household and any small, stable social bubbles you might have from the virus, particularly through these next 3 weeks. Now is not the time to be socially gathering with multiple households. The third aspect is a big advancement for us, is that before people were waiting for test results to come back, but if we know that household transmission is occurring, we need to tell people as soon as they develop symptoms to mask, isolate themselves from other family members as to the extent possible, quarantine other household members who might become infectious themselves, and seek testing. So as soon as possible, having those things happen will prevent transmission within the household and transmission outside of the household as well.
Yeah, and the exact type of things that you're talking about, which are so necessary, they do also tend to isolate people, whether it's quarantining or limiting their social bubbles more. So Dr. de la Cruz, I know that the county is trying to beef up support for people who are very much suffering from pandemic fatigue. Can you talk about what you guys are doing?
So we've had increased calls to our call centers, and the length of the calls have been longer since the pandemic has started. But unfortunately, the number of people who are presenting for care, whether it's in the ER or outpatient clinics, is lower than expected. So we're very concerned that people are staying home because they're scared, or maybe the direction is, it's confusing for the public. So we're taking every effort, making every effort to reach out to people. And also to share this information, just what Dr. Chan talked about, so they can, be assured what they need to do to be safe, and how they can reach out to people to get social support while also masking and maintaining distance and keeping themselves and their families insulated and protected.
Yeah, I mean, it's a delicate juggling act for sure. I do want to mention that San Mateo is not the only Bay Area county to not implement the stay-at-home order before the region needs to, because Sonoma, Napa, and Solano are also making that choice to stay put for now. Dr. Chan, look, you have tons of supporters I've seen on social saying, this is the right action, but also some detractors for the decision, and some say, hey, look, even if the data doesn't show these businesses are really driving transmission, for example, outdoor dining, et cetera, if curbing them might help a little bit, just a little, why not go along? What is the downside?
Yeah, I think first of all, I just want to emphasize that our other counties are right. We need to sound a large alarm, and we need to do something immediate. Our data doesn't show that there's a lot of transmission happening in our county through, for example, barbershops and nail salons. There wasn't a lot of, from the science, there isn't a lot of transmission happening in playgrounds. And there wasn't, and we were concerned that also messaging towards saying that you shouldn't have any contact with any social support system, anybody outside of the household. Having those types of messages, we thought, for our community would be actually detrimental, and we would lose credibility of other important public health measures. So we're listening to our community, looking at our data, and trying to do the best for our community. But make no mistake, all the other counties that have sounded the alarm, they are correct. We need to have a very loud alarm. And I'm not saying that our approach is absolutely the best approach, and we just need to be humble about this and continue to modify as this pandemic surges.
Yeah, I mean, I want to explore this either or, black or white, right or wrong morally issue with both of you. We certainly have seen some elected officials recently seemingly going against their own rules. How much do you think it's hurt us that there hasn't been the recognition or acceptance that nobody is perfect, nobody can keep up with one thing all the time, and that we need to just learn best practices and try to engage and make the right choices the best we can? Dr. De La Cruz, what have you seen on that?
We have a concern that the strict orders are going to upset people who are already stressed and drive behavior underground. And I think these measures about masking and insulating your bubble can help protect your family if somebody in your family is engaged in riskier behavior, if they had a momentary lapse. It's just because you had that, it doesn't mean you throw everything out. Then you really do what you can to follow these. We just really want to emphasize the protocols and emphasize what people can do to protect themselves and insulate their families.
Dr. Chan, I wonder if you worry a little bit about people adhering to all these things that you're asking them to do right now, from the masking to the smaller bubbles, et cetera, because every time you have a rule and then you kind of pull back or change it, do you feel like people lose a little bit of their will to follow? For example, the latest this morning, right, with the playgrounds. First, the state banned it, but then now they're saying, okay, it's, that's okay. And we've seen a bunch of other things like that. What is your thought on that?
Yeah, I think that's the nature of when we roll up restrictions and roll back restrictions without actually changing the understanding of the disease and what we need to change as behaviors. I think that's the reason why our new health advisory, establishes principles that matter whatever the stage that we're in. So just to be clear, we also discourage social gatherings of multiple households. So we're in the same boat as the other Bay Area counties are. And again, we want to sound this alarm very, very loud. And we're hoping that more people would actually just listen, because we're asking people to cooperate and love your neighbor and care about your neighbor. And we're providing the science in a more clear way. Just to remember, over half of the transmissions are due to are from cases without symptoms. Over half of the cases are from people without any symptoms. So somebody could be not coughing and still easily transmit it to you. So this is a very unique feature of the virus that we really need to do a better job explaining throughout the whole country.
Today, I checked your website. It shows that San Mateo County has 13%, correct me if I'm wrong, for 13% ICU beds available. The region does have close to 21%. So given the fact that your county has less, is that a factor at all in maybe pulling the trigger and implementing the stay-at-home?
Yeah, I think we're still planning to follow the state guidelines, and the triggers that we're pulling right now, we think are going to be more effective than merely some aspects of the state guidelines. So we're doing a lot right now, and eventually when the state guidelines come in play, and it's basically the additional things layered would be, closing barbershops and nail salons. I don't know if those things are going to make that big of a difference. Like I said and emphasized, we need to do something really big right now as a community. Every single business, community-based organization, faith organizations needs to explain to their members that this is extremely transmissible, very deadly, particularly to older adults, and transmission happens even without symptoms. That's just a really difficult concept to explain, and the CDC has only started explaining it clearly in the last few months. So I think that's our main message that we want to communicate to our community members.
All right. We did have a question on Facebook asking how will you communicate that message differently so that people get it, because it's been a few months and you have been emphasizing that. And as Dr. Scott Murrow said, I believe the power and authority to control this pandemic lies primarily in your hands, not mine. So I do hope people will listen this time. Dr. Chan and Dr. De La Cruz, thank you both so very much. By the way, folks, if you haven't read Dr. Scott Murrow's entire statement, I do hope you will. Don't jump to conclusions. It is very thoughtful, and it's posted on abc7news.com. Thank you both.